Hello, good evening. So, welcome to this session on OET writing. Today, I will be discussing on grammar and specifically on tenses. So, I think we'll wait a few minutes because, yes, it's just getting on the right time. Yeah, okay. Well, I think we'll just start. So, I know the moment you hear grammar, it doesn't sound very good. My today's topic is why is using tenses important? The moment you hear the word tenses, I know your mind goes back to the old school days when we were told about tenses and all those V1, V2, V3 forms and all that. A lot of things just, I know, came into your mind. Yes, I could get it. However, it is important, but I do not want to confuse you by saying it's V1 or V2 form. I will just get on to the important tenses that you use in OET, specifically what you use in writing, and some of those what we use in speaking as well. Actually, using the right tenses help you understand the time period which is very essential in OET writing, as you must know about it. But you don't have to use all the tenses. Like, for example, most of the time you don't use the future tense. So it's basically the present tense and the past tense. And I would like to just tell you that using the tenses is only required when you need them. So use the tenses accordingly. Don't just use tenses because you know about them and you want to boast your knowledge, because that just backfires. So it would be better if you just learn where to use your tenses and how to use them. Yes, I can see that. Yes, people are joining in. Yes, great. Okay, so we'll just get the right tenses and um, I know it's difficult for you to get what, right, what tense is required in this particular place. But yes, at Envertiz Academy, we help you with it. And my name is Dr. Mary Binoy, and I'm a language trainer here. So please, if you have any doubts, do come in, join our institute. We are there at Kochi, at Tripunithara specifically, and we do both online and offline coaching. We have coaching for IELTS, OET, PT, and German. So do join us if you need help for any of these courses. So, right back to the grammar, what we were discussing. Well, we need just four basic tenses, four or five, I would say. The present simple tense, the past simple tense, present perfect, present continuous, and present perfect continuous. So we're very limited number of tenses that we have to use. So I think we will start with the first one. The first tense that I would like to discuss is the present simple tense. Well, as the word indicates, it's simple, but not as simple because we need to know where to use it. So when you get a case note, you usually see a case note that says live Edmonton or married engineer, two children. So, how do you present this? This is information that needs the simple present tense. And why do we use simple present tense there? Well, these bits of information that we have are unchanging facts, which means that these facts are unlikely to change. So, I would just like to give you a few examples on how to do it. So, we have the the first one which I said was married. Well, you can write it as she is married or he is married. He or she is an engineer. She lives in Edmonton. She has two children. He or she has an allergy to penicillin. So all these sentences are written in simple present tense, and as you can see, these are facts that are not going to change. And that is why we have put them in simple present tense. So, you need to practice these. It's not that you just learn all this by heart. It's not possible. So you need to know where to use this. You need to practice, and to practice you definitely have to take the help of an expert trainer. So we at Envertiz are here to help you. Do join us. Okay. And I guess you remember the sentences we learnt at school, which had the same tense, like the sun rises in the east or the sun sets in the west. All these sentences use the present simple tense. So it's the same. When we come to OET, we use sentences that are required for our case note. Well, we do use this tense in speaking, especially when talking about our daily routine. Say, for example, you want to say how your day went. When you're asked the question, what is your daily routine? So you would say, I wake up at 6 a.m., then say a prayer before starting my day. I brush my teeth, and so on. So, whatever you say would be in simple present tense because that's something unchanging. It's a daily routine. So that's it with present simple tense. Let's move on to the next tense, which is past simple tense. This tense is used when background information is also required. So let's look at a few examples on those. The patient presented 2 months back with a fever. So presented, that's past tense. Next, today he represented with fever and headache. Again, a past simple tense is used, represented. Next, the patient complained of severe pain in her lower jaw yesterday. So we have told a time period there. The next is I administered the prescribed medicine and monitored the patient's condition. Yes, I have done it. It's just in past simple tense. And these sentences would have happened in the past and were completed in the past. So we leave it at that. This is how we write about the past simple tense. So I guess you're getting a hang of it now. So let's move on to the next tense, which is present perfect tense. This is when you are talking about these actions also occurred in the past, but is relevant in the present as well. Okay, yes, I can see some of you have joined just now. Yes, we just talked about the present simple tense and the past simple tense. Probably I'll be doing a review of the whole thing at the end so you wouldn't miss anything. Well, this, what we are talking right now, is the present perfect tense. And I would like to give you a few examples on those. The patient has responded well to the treatment and is showing signs of improvement. So it's has responded. We have written it in present perfect tense. She has undergone several sessions of physiotherapy which have helped to reduce the pain. So, has undergone. The next is the lab results have indicated an elevated blood sugar level suggestive of diabetes. Yes, so we have three sentences here which tells us that the action occurred in the past but is also relevant in the present. So, all these sentences give you an idea of how to use it. We have got sentences used in different scenarios. For example, the first one is how the patient has responded to the treatment towards the end. That's how we write before the discharge plan. This is how what is given, what has to be written. Then, if you are telling about the treatment, you would tell about she has undergone several sessions. She has undergone, so that's already completed. Similarly, they have the lab results have indicated, which means the lab tests were done and they've got the results, and this is what it indicates. Okay, which takes us to the next tense, which is present continuous tense. These have no relation to the past and exclusively talks about the present. For example, yeah, we have got sentences. Okay. We have sentences like he's currently receiving oxygen therapy to improve his breathing, which means that this is being done currently. One more sentence. She's currently undergoing a series of tests to to determine the cause of the symptoms. So that's another sentence where we say that, something has happened, and they have no relation to the past. So it's currently receiving oxygen. So it shows that presently the person is receiving oxygen. Okay, which takes us to the last tense that we require in OET. It is the present perfect continuous tense. This indicates or describes actions or events that started in the past and are still continuing or have recently finished, often with a focus on the duration. So, of the ongoing or the ongoing nature of the activity. This I think, or most of us would have done. So I just want to give you an example of a case note, and let's see if you can come up with answers for these. For example, say you have the word smokes, and beside it in brackets we have cigarettes, and in another bracket we have 10 years. Well, how would you write the sentence? Give it a try. I know we're just starting on, but I think those of you who have attempted OET earlier or have gone through case notes might have an idea. Yeah, let me see some answers, please. Yes, yeah, I know some of you are trying. Yes, please, let me see. Mind you, we have a time period. That's what the this particular tense is all about. It's the present perfect continuous tense. It tells us that the events that started in the past and are still continuing, and it has a duration. So we have all these conditions here. We have told about the habits: smokes, cigarettes, and 10 years. Yes. Yes, I can see answers. Yes, yes, a lot of answers. Yes. So let's just uh, check on the answers. Yes, the one that I had just told, it was he or she has been smoking cigarettes for the past 10 years. Exactly. Yes, I can see many of you got that right. Yes, it's so since we have a time period, we use the word for. Now, let me give you a different scenario. If it's smokes, uh, the same thing, cigarettes, and instead of the time period, we have a particular year, say 2020. How would you be using that in a sentence? Yes, can I have the answers, please? Yeah, okay. Yeah, the second one would be he or she has been smoking cigarettes since 2020. So when the word since came in, we changed the sentence, and it has, that when it's the year that's given, the word since has been used. For 10 years, we use for. So this is a difference, basic difference here. Now we have some on the screen. We have smoker, and if it's written ceased, it means that he or she used to smoke, which indicates that the action was done earlier. Well, this has nothing to do with the tense that we just discussed now, but I'm just telling you in case you come across something like this, it's an extra tip from me. Well, if we have something like smoker, and we have in brackets cigar, 10 to 12 per day and 5 years, we have a bit more information. How can you include it? So you would be writing he or she has been smoking 10 to 12 cigars per day for the last 5 years. So we have included all the information that has been given to us. We have included that this person smokes, this person has been smoking 10 to 12 cigars per day, and that's been going on for the last 5 years. We've included all the information. So I think now you have quite a bit of idea on how tenses are used. So this was something that was, I think, quite easy. But before we go on to the next portion, let me just go through a recap of what I just explained to you so far. We just talked about the present simple tense, past simple tense, present perfect, present continuous, and present perfect continuous. Well, in the present simple tense, we said that information that does not change, that is unchanging facts, are written using present simple tense, whereas for the past simple tense, we use when the background information is also required, we use the past simple tense, and we discussed a couple of sentences on that. Then we went on to the present perfect tense, where we said that actions also occurred in the past but is relevant in the present. We had said about a few examples where we told about different scenarios, like for example, she has undergone several rounds of physiotherapy which have helped to reduce the pain. The next tense that we discussed was the present continuous tense, where we told how we use the word currently to say that the action is ongoing. And then we came to the last tense, which was the present perfect continuous tense, which said that we told about actions or events that started in the past and are still continuing or have recently finished. Often it has a focus on the duration as well. So that's when we brought in the time period or the particular year and how we had used them. Now, I would like to go to a little more elaborate material. I would like to talk about certain case notes and how these case notes are made into letters using the right tense, and how we can do it. Well, these case notes have a writing task right at the end, and I'm sure you've been told that when you get a case note, the first thing that your eye should go to, rather I should tell the second thing, because after understanding who you are and what is the background information, then you need to go to your writing task. And your writing task tells you who the recipient is and why are we writing this letter. So based on these two information, you have to formulate an introduction for the letter, and this introduction requires you to use the right tense. So to do this, I think it would be just right to get in some case notes, show you the case notes, and then go on to how the introduction is written for each of these case notes. So let me just take you through one of these case notes. So here we have the case note. It is, yes, let us just first go to the writing task. Before we go to the writing task, let's just get the background information. So we have the background information. It says Mr. Sam Paul, a 55-year-old, is a patient in the medical ward of which you are a charge nurse. So you're a charge nurse and this patient has come in. Now, what is the writing task? The writing task says write a referral letter to the charge nurse who will be looking after the patient for his condition. So you are sending this patient whom you've just done certain investigations. You're sending him for the management of his condition. So you're sending him to another nurse who will be looking after him thereafter. So how would you write an introduction for this particular case note? We just go through it quickly. So the name of the patient is given as Sam Paul. He's married. Okay, so the diagnosis is pneumonia. We have a couple of past medical history, social background. Um, yes, and we have the past medical, the present medical history of this patient. We have the medical background, the progress, how he is, the investigations done, and the investigations actually confirm pneumonia. So we have just started with antibiotics and fluids. We are sending this patient for what? We are sending him for continuing the treatment. So the nurse who will be looking after him needs to continue the use of a breathing machine and continuous monitoring of patients. So keeping all this in mind, how would you write an introduction for this case note? So let's give it a try. I want all of you to write on that, because I know what I think we have already discussed on what an introduction should contain, the three P's. So, say we need to have the purpose, the name of the patient, and the present condition of the patient. So, keeping all this in mind, let's write an introduction. Come on. I want all of you to try that out. Write an introduction so that we can discuss how it is. Yes. Come on. Yes, yeah, I have some of these answers coming in. Yes, I can see. Yes, okay. Yeah. I will just read out mine and so that you can see how whether this is what you have written. I'm writing to refer Mr. Sam Paul, who has pneumonia. He requires management of his condition. So we have just diagnosed it. So we're just going to say who has pneumonia. Or you could also write, I'm writing to refer Mr. Sampol, who is being treated for pneumonia. He requires further care and management. Well, you have two different ways that you can write because you're writing to a nurse who is going to be taking care of this person for the rest of the days at the hospital. So you're telling he needs further care and management. So you can write who has pneumonia or who's being treated for pneumonia. Now we have a different scenario. I'm just giving a little change to the writing task. Okay. And I'm going to write using the information given in the case notes. I've just given a slight change. Write a referral letter to the ward nurse who will be looking after the patient. So probably he's gone from the stage where he was down with pneumonia. He's recovering now. So you could say, I'm writing to refer Mr. Sampol, who's recovering from pneumonia. He requires further care and management. So a slight change in the scenario, and you have a different introduction. Yes, I know many of you got the previous one right. Yes, say you need to include the patient's name, the complete name. I've seen some of you have not included the complete name. Some of you have not written the entire present condition. So, who has pneumonia or who's being treated for pneumonia. Now, this is a different scenario. So, we write who is recovering from pneumonia. Now, we have a different, I would like to go to a next case note, which says about this same patient, but we have a slight change in his situation. Well, the initial information is the same because obviously the past medical history, the social background, everything remains the same. So we have Mr. Sampol, and we have this basically the same information. Now the second part, the medical background, we have realized that he has this acute SOB. Mind you, when you write your letters, please do not use short forms. You need to put acute shortness of breath or dyspnea. Okay, then we have already diagnosed the person with pneumonia. He goes on antibiotics. It's the scenario when the nurse has taken care of the patient and the patient has all recovered. Now he needs what is given here is write a referral letter to the community health nurse for daily home visits. Yes, you've probably heard about this, something similar where you need home visits. So you're asking the nurse to visit, the community health nurse to visit this patient. What is it for? For continuing the chest physio at home, to give paracetamol if necessary, maybe to help him with his nutrition and help him to keep warm. So all these things have been included. There's a slight change, so obviously the introduction has to change. Now, get busy, start writing your introductions. I would like to see this introduction as well. Yes. So, mind you, you need the three P's. You have to tell who the patient is, what is the condition. Yeah. So, I think as you get busy on that, I will take a short break and I will come back after the break and we'll discuss how the introduction is going to be. Yeah. See you after the break. Hi, welcome back. So I guess I just given you a homework. I hope you have done it. Not a homework, I would say. I just told you to write an introduction. Well, just let's see how you have done it. Yes, I can see quite a number of people who have answered to it. Well, this is what I required. I'm writing to refer Mr. Sam Paul, who has recovered from pneumonia. He requires follow up visits for further management. So you're asking the nurse to come visit him at his home. That's a home visit. That's why we have written follow up visits for further management. We could also write this as I'm writing to refer Mr. Sample, who has been treated for pneumonia. He requires further care and management. Well, when we write who has been treated for pneumonia, we are keeping that an idea that it could recur, it could reoccur, maybe if he's not taken care of properly. So, who has been treated says that you have to be a little more careful, and pneumonia is something that could recur, so it has to be taken care of. The last way of writing it is I'm writing to refer Mr. Sam Paul, who was treated for pneumonia. So he's already been treated. That's done with it. He requires further management. So here we have not, written about the follow-up visits. If there is home visit written, you have to specify he requires follow-up visit for further management. That would be the appropriate one. So now we have discussed three ways of writing it. So I'm sure a lot of work has been done today. I mean, we've discussed a lot on this. I've discussed a lot on the different tenses that have to be used. I've told you a couple of sentences on each of these tenses, and we discussed two case notes and how to write the introduction using the right grammar. Um, I guess it was quite a lot, but then this is the basis of any OET writing. You need to know what tense to use, how to use the tenses, and see that you use the tenses at the right places. Don't just put something there because you just heard about it, you've been taught about it, and you want to use it. No, that's not how you do grammar. You need to use the right tenses at the right places. And sometimes when tenses are not used to the right places, it tends, like I just mentioned, it's not in the right place, you lose marks. Because as you know, one of the criterion of your writing is language, which includes your grammar. So your grammar is not right, your meaning will not be the right. I just would like to give you an example. Say you are writing for the first case note where you had just diagnosed the patient. You are going to write, I'm writing to refer Mr. Sample, who was treated. He has not been treated. So when you use this, the word was treated, you have said that, you have indicated that he's already been treated. He has not been treated. It was who has pneumonia or who is being treated for pneumonia. So there's a difference there. You can understand. So it's always better to get your grammar right by looking at the tenses and looking at who the recipient is and what has to be written. Well, I would like to give you a few suggestions on how to get your grammar and your tenses right. Firstly, get feedback from experts. Very important. You need to get feedback in the sense, write your letters, take case notes, take different types of case notes, write them, get the feedback. Feedback is always important, and get feedback from experts. Well, we at Envertiz are here to help you. So please come, join our offline or online batches. We are here at Tripunitara, and come to us. We will teach you how to write your grammar right and get the required score in OET. Next, self reflect on your mistakes. You make mistakes. We all tend to make mistakes. No one is perfect, but you get to perfection only when you reflect on your mistakes. See where you have made the mistakes. Maybe it would be tenses, or maybe it would be the way how you are presenting your information. For example, the last few sentences we saw how some of them have not written the full names, or they have misinterpreted the data given. So it's always better that you go through your data, understand how to do it. If you've made mistakes, self reflect, understand why you have made mistake, and avoid those mistakes. See that you don't make or repeat these mistakes, because once done is a mistake, twice done may be a mistake, third time it's a deliberate thing. So you need to avoid these mistakes, and as always, practice, practice, and practice it. might not make you perfect, I would say, but at least it makes you better. So it's always better to try than to just say that, well, I'm no good at grammar, I'm no good at English, because I know English is a difficult language, especially since you have grammar and you have a lot of words which might sound like synonyms and not that. Yes, we would be doing another special class on synonyms and where to use it and how to identify these synonyms. Well, that's very important in reading. Yeah, I know it. Yes, yeah, I'm getting a lot of people asking me for more grammar classes. Yes, yes, there will be more grammar classes. I know how difficult things are and how you find them difficult. Um, One tip that I would like to give you is, please do not translate right from your mother tongue into English. That doesn't work. So always think in English and write in English. Keep practicing with experts. So we at Envertiz would like to help you, but you have to come to us to join us for our classes. We have both online and offline sessions, and we have expert tutors here ready to help you. And we could do all these corrections, because once you write a letter, you need to get it corrected by someone who's an expert in the field. Only then you know whether your writing is good enough. I know most of you like to sit at home and practice. Good enough, but you need someone to check your work, make you help you with your mistakes, unlearn those, relearn. It's a difficult process. I know, I get it. Yes, there are specific requests coming in. Yes, there are people asking me for more examples on since and for and from and where to use this. Yes, probably we'll be doing a session on prepositions. Yes, we will be doing it. Yes, then yes, yes, active and passive voice, definitely, definitely. Active and passive voice, something that has to be done. Yes, when you write a letter, I know how difficult it is. Yes, I just handled a letter today. It had a lot of passive voice and active voice all mixed, and I know it was quite difficult for the student as well. But I want you to go think about it, reflect on your mistakes, go through it. So, as I just told you, we just completed the five tenses: the present simple tense, the past simple tense, present perfect, present continuous, and present perfect continuous. I hope you recap everything in your mind. You've written down notes, go through it, and you have doubts, you know whom to approach. We are here at Envertis. Please do come. So I wish you all a great day. Hope to see you for the next session. And this is Dr. Miri Binoy signing off for now. Bye.